Nurses in the COVID-19 pandemic. At the beginning of the year 2020, it is safe to say that we all experienced and had to adjust to a new life under the influences of the heightening COVID-19 pandemic. While many of us quarantined at home and began virtual work and schooling, nurses still had to go to in-person work. Their job did not get easier, however, but it got harder as they constantly put themselves in danger by working directly with COVID-19 patients. They endured longer hours that, in some instances, resulted in both mental and physical health problems due to the increased stress. In this presentation, I will be analyzing the effects of the COVID-19 pandemic on those who worked on the front lines of battling the disease. In collecting data for my final project, I wanted to use a combination of both news and scholarly articles, as well as a public survey that I sent out. This method of data collection allowed me to research both from an academic perspective and from a more informal perspective by hearing the stories of nurses working on the front lines. The survey that I created, which is linked on the slide, asked questions about nurses' physical health, mental health, and overall experience from working during the pandemic. I sent this survey out to over 10 area nurses and was able to get 12 insightful responses from it that will be interwoven throughout my PowerPoint presentation, along with the news articles and scholarly articles that I used. The sources are all referenced at the end of this PowerPoint. So I hope you liked that video and found it really impactful and insightful, and now we're going to be talking about the physical health effects that COVID has had on nurses. So the first and probably biggest factor that has played into nurses' physical health during the pandemic has been the prevalence of infection in them. It's hypothesized that nurses and other healthcare workers are more likely to contract COVID-19 due to their constant exposure to the virus. According to an article that was published in the Lancet Public Health Journal, 10 to 20% of COVID-19 infections occur in healthcare workers, which is a bit larger than the general population, and my survey that I sent out to local Indiana nurses revealed that 16.67% of survey participants, which was 2 out of 12, had contracted COVID at some point during the pandemic, which lines up with the quote from the Lancet Public Health. A source of error in my statistic from my survey could be the fact that I only surveyed local Indiana nurses. Since COVID has not been super bad in Indiana as compared to other states like New York and California, I would expect these numbers to be higher in a different state other than Indiana, or one that was more harder hit by the pandemic. The second quote on the page states that the prevalence of COVID-19 was 2,747 cases per 100,000 frontline healthcare workers, compared with 242 cases per 100,000 people in the general community. So I think that statistic just does a pretty good job about really showing the difference between healthcare workers in comparison to the general community, and it points out the fact that healthcare workers are constantly putting themselves in line of the virus in order to care for their patients. So now I would like to talk about other physical health problems that nurses have faced in fighting the pandemic. An article published in the International Journal of Emergency Medicine stated that due to wearing uncomfortable and abrasive PPE like gowns, masks, and gloves, 97% of medical staff had skin damage, especially in the nose region. According to my survey, which you will see on the right, 50% of respondents reported this skin damage, which is actually quite a bit lower than what was reported in the journal. In my survey, you will also see that there was a 91% report of increased fatigue in nurses. The second blue line on the chart also talks about the physical manifestations associated with stress that nurses have faced. There was a 50% prevalence of insomnia in respondents, and one respondent stated that they did not experience any of those physical health effects while working in the pandemic, but most nurses answered at least 2 or 3 of the issues. The next thing that nurses have faced as a result of the COVID-19 pandemic has been increasing mental health issues. So as we all know, COVID has been stressful for everyone, but especially more so on nurses who have been exposed to it every day. Data from the International Journal of Emergency Medicine revealed that 23 to 44% of nurses suffered from overall anxiety, 27 to 71% suffered from a stress disorder, and 50% suffered from depression. The same journal also revealed that reports of anxiety, stress, and depression were higher in females and in nurses rather than males and doctors. Then you will also see the data that was from my survey that I conducted at the bottom of the slide. And these are pretty interesting because unlike the journal that said only 23 to 44% of nurses suffered from anxiety, 12 out of 12 of my respondents suffered from anxiety, which was 100%. My statistic on stress was also fairly higher with 83%. 50% of respondents said that they had experienced depression. 83% said that they had had feelings of being overwhelmed, and 91.67% said that they experienced lots of mental exhaustion as a result of the pandemic. My survey could have higher statistics due to the fact that all of the nurses that answered my survey were female, which means that they were likely to experience higher levels of anxiety, stress, and depression. Now it's important to analyze the causes of the increased mental health issues in nurses throughout the pandemic. One reason that they could have had increased stress and anxiety could be the increased number of patients to care for. While they may have normally only been caring for 3 to 4 patients per shift, their numbers were likely increased at some points due to the influx of COVID patients. Some nurses may have also experienced PPE shortages and have been worried about the risk of contracting the virus subsequently. They also had more critically ill patients to care for, which meant more work and a lot more stress. They may have also had stress that stems from ill family members, as many people were affected by the virus themselves, with their loved ones, friends, and family members getting sick. And another cause of stress could be being the only support available for a sick patient since their families could not visit. So while normally sick and dying patients are able to have their family at their bedside, nurses were the only ones available to help them, which could have been a great cause of stress as they felt responsible for the patient more than they would in a typical year. To further support the point that nurses may have been affected by the death and illness of loved ones, as well as the different guidelines that hospitals have had in terms of family visitors, I would like to share this that was shared in my survey. So the last question of the survey that I sent out just said, is there anything else that you would like to share about your job? And this is one of the responses I got. It says, I have lost a family member to COVID. I have worked 2 months straight in the ICU, so the mental fatigue is exhausting. What I would like to say is that I can identify with the family members of these patients. I never got to say goodbye to my grandpa. We never had that opportunity. Things need to change so that these patients have their loved ones at their bedside in the end of life. And so I just thought that that quote was really impactful and did a great job of showing sort of the mental turmoil that these people have gone through, both from their job and from things that have happened with their families. And lastly, I would like to talk about some other effects that COVID-19 has had on nurses. First of all, job satisfaction has changed due to the pandemic. As working got more stressful with increased death and the risk of contracting COVID-19, the enjoyment that nurses got from going to work was definitely affected. One of the questions on my surveys asked respondents to answer if their job satisfaction had increased, decreased, or stayed the same during the pandemic. The results revealed that over half of respondents had a decrease in job satisfaction associated with the pandemic, and this could definitely be correlated to the increased anxiety, depression, and stress that nurses have experienced. Not only that, but 83% of the survey participants said that working during the pandemic also affected their home life. This could be due to the fear of bringing COVID home to their families, as some nurses even didn't go home to their families that night. They would rent a hotel or go into an apartment because they were afraid that they would bring back COVID to older people in their household or young kids that were going to be more susceptible to the virus. It was also difficult for people to have a normal home life when they were struggling with mental health issues themselves. And on the next slide, you will see an example of home life. The text on the screen is an excerpt from an article that I found on the Fox 10 Phoenix News website, and it basically just gives an example of what one family experienced during the pandemic. It says, for the month of April, the Cushing family lived apart. Spencer Cushing spent his days and some of his nights at St. Jude's as a nurse caring for step-down patients recovering from the most serious COVID-19 symptoms. When his shifts were over, though, he wouldn't go home to his wife Eleanor and young sons, 3-year-old James and baby Walter. The reports from New York were frightening. Hospitals overwhelmed, medical staff working without proper protective equipment, the death toll climbing. Was California next? We weren't sure what was safe, Cushing said, but we knew what we were doing was the safest. So, he rented his own apartment, returning there after his shifts as Eleanor put the boys to bed alone at their home. James began sleepwalking. Walter grew 4 new teeth and learned to roll over. Eleanor gave up her own part-time night nursing shifts at St. Jude's so she could stay home with the kids. On his days off, Cushing would come over with breakfast burritos and groceries and talk to his family from a distance. Sometimes he came back at night when the boys were sleeping to have a socially distanced date with Eleanor over a patio campfire. And so I just really liked that little excerpt because I thought it gave a really good view into how COVID has affected nurses' home lives, because I don't think it's something a lot of people think about. They more think of how working in a hospital has changed, but these effects have also spilled over into the home life of nurses and healthcare workers. In conclusion, it is safe to say that COVID-19 has affected all of us, but perhaps it has affected nurses and healthcare workers more than other people. They have not only experienced a difference in what their job is like, but in result they have experienced mental and physical health issues that have carried over into the rest of their daily lives, as seen in the slide before this. The goal of this project was to raise awareness of what nurses have experienced, and I want people to remember and be thankful for everything that nurses have done in fighting this pandemic and caring for our friends and family members. I hope that something I said has stuck out to you, and that you will be able to better empathize with the nurses in your life that you know.